Welcome to the GenoCare podcast. Today, I'm joined by Kathy Solanki, who's a credentialed perinatal mental health nurse and a midwife, and she's part of our GenoCare team, and we're really fortunate to have her on board with the team. So today, we're going to talk about the emotional considerations in pregnancy and how people might manage in stressful situations. Welcome, Kathy, and thank you so much for joining us and sharing your wisdom.
Thank you. Thanks for having me.
All right, let's start with a broader question. I think there's a general awareness that pregnancy is often described as being an emotional time. From your perspective, and I guess deep expertise in working in this area, what is it about pregnancy that tends to heighten emotions, and what factors can contribute to that?
Ali, in pregnancy, I think a woman experiences such profound shifts physically, socially, and psychologically. There could be a multitude of factors that might be occurring in any of those domains, and that can contribute to the heightened emotions. If you think physically, there's a lot of hormonal shifts. Women are experiencing those early symptoms of pregnancy like fatigue and nausea. As the pregnancy progresses, they might have backaches and indigestion. And those physical experiences might contribute to emotional responses. I think psychologically, there could be ambivalence about being pregnant. Even if the baby's planned and wanted, expected parents might still feel shocked or anxious, worried. Are we doing the right thing? Is this the right time to have a baby? Expected parents also start to reflect on their own childhood experiences and start to wonder or think about what kind of mother or father will I be? And that may provoke anxious kind of feelings. I think there's identity shifts. So starting to reflect on what impending motherhood might mean. So for some women, it might be shifting from a professional life to family life. Couples who might be having a first baby. It's not going to be the two of us anymore. We're going to be a family. And how will this new baby fit into our lives, and what's that going to look like? I think there's a level of uncertainty and unknowingness in pregnancy. There's a lot of things we can't predict or know exactly, for example, when the baby's going to come. Is it going to be a vaginal birth, a cesarean? Sometimes we can plan for these things, but sometimes we can't. Is it a boy or is it a girl? And I think for some, sitting with the unknown and uncertainty can be a challenge as well. So I think a lot of those kind of emotions in those domains are expected, but I think when they become prolonged and intense and interfere with that normal woman's functioning or post-birth and her adjustment to parenthood, I guess that's when people are wanting or needing support.
Yeah, it's such a good summary, because immediately my brain goes back to my own experiences of pregnancy, and certainly a lot of that resonates with me. And it's that overlap, isn't it, of the physical impacts and the psychological, and then, as you talked about, the identity shifts and the context of uncertainty that comes with pregnancy. So are there certain circumstances or experiences that can make pregnancy even more emotionally challenging for some people rather than others?
Definitely. And again, I think the experiences or circumstances might occur in any of those sort of domains that are outlined. And if you have those particular experiences or circumstances, then pregnancy might be more emotionally challenging. So, for example, if we think of the physical domain, some women might have complications of pregnancy, like things like hyperemesis, so excessive nausea and vomiting. They might have gestational diabetes, high blood pressure, and this adds complexity to the pregnancy journey. So they might need medications, increased hospital visits. The complications might also contribute to the health of the growing baby. So that could lead to feelings of anxiety or maybe a sense of failure. So sometimes people feel that their body is not able to support their growing baby, and that may contribute to emotional shifts or adjustments. And I think many individuals or couples might have a history of perinatal challenges, so losses like miscarriages or terminations, a challenging fertility and conception journey. And in these situations, I think emotions can be heightened because they might be, again, worried about the ability to hold this pregnancy and carry the baby through. And there might be trauma itself for the physical and emotional toll of fertility treatment itself. I think there could be difficult social circumstances for the woman or couple So financial difficulties, it might be an unhealthy relationship, there might be unstable housing. So if we feel, I think, that we can't provide safety and meet the needs of our child, I think that can cause distress for expectant parents. But it can also mean it's really hard to focus on the baby because the woman and couple are just trying to meet their basic needs. So how can they actually be present for this baby that's coming? The woman might have had adverse childhood experiences, and pregnancy might trigger reflections on those experiences, and that can contribute to distress. So here I think about women who might have experienced sexual trauma at some point in their life. So the physical experiences of pregnancy or impending labour and birth might cause intense anxiety. And I think how these challenges are managed are going to depend on the woman's psychosocial support system, but also her coping style. So the capacity of that person to manage those challenges they might be faced with. Because for some people, they might be able to work through that, but for others might need actually support around that.
It's so interesting because, there are so many different factors, aren't there?
Mm.
So then when we think about it in the context of prenatal screening and diagnostic testing, that can also obviously add another layer of complexity. But what kinds of emotional responses can people commonly experience when they get this type of unexpected news in pregnancy? And I guess taking into consideration the background that you've just described,
Yes.
and whether or not those factors are there too. But what is the emotional response like when something unexpected comes up?
And I guess reactions are always going to be individual and unique to that person or couple. And it could be things like shock, anger, sadness, fear and anxiety. So what does this mean for our baby? If there is a particular diagnosis, what is this going to mean for our family? I think people have hopes and dreams and ideas of an imagined baby. So I think it challenges that because it turns their whole ideas or world upside down. I think other people might actually shut down, so feel quite numb. There might be a sense of disbelief, being cut off. And I think I was thinking about the previous podcast that you had with Peter Shakes and her writing around this idea of threat, and that those ideas for some might feel under threat. And so then people, experience high levels of stress. So this is not what we imagined. This is not the pregnancy journey we imagined. This is not how we envisaged or what we envisaged for our family. And I guess the responses are ultimately, like I guess you alluded to, are going to be influenced by that couple's values, beliefs, the support system around them, their journey, life journey already, and what has happened to them, their family. All that is going to influence then the actual response and their unique coping styles. And I think also what's around them, like I was thinking about how the news is being delivered to them and communicated to them, will also, I think, influence their response. So I think it's a broad range of emotions, and people bring their own unique life experiences then to that as well. So, I think it can be complicated.
Yeah, absolutely. So diving a bit deeper into it and thinking about the actual, when those stress levels are high, what actually happens physiologically in the body when we experience stress and anxiety?
So I guess when we experience stress or a threat, our body goes into that stress response. And this is a survival mechanism that often we don't have control of. It's the fight, flight, or freeze response, which people may be familiar with. So we have an area deep in our brain called the amygdala, and it processes that stressful event and it communicates to another part of the brain called the hypothalamus. And this hypothalamus actually tells our sympathetic nervous system, which is our fight or flight system, to get working and get our adrenal glands pumping and start producing adrenaline. And when that's pumping around our body, it gets our heart pumping, our heart rate up, our blood pressure goes up. We might start to breathe quicker because our body's getting ready to address the threat. And we also get sugar and fats released, so our body has energy to be able to do that. So that's the initial kind of response. Then the hypothalamus has like a secondary mechanism where it then tells our bodies to produce another hormone called cortisol, to keep that fight flight mechanism going. And so when the threat subsides, that our cortisol levels come down and another system kicks in, and that's called the parasympathetic or rest and digest system. So the body's got its own mechanisms to down-regulate, but in situations of extreme stress, sometimes our stress response system doesn't know how to shut off, or it stays on, and we might need external support to help down-regulate.
Amazing. I think that's a helpful summary of what's happening, physiologically. And I think sometimes that happens and we don't necessarily have a conscious awareness of it, particularly when we're very overwhelmed. I was having a very interesting conversation with my 9-year-old coming back from the dentist this morning, where he'd just had a procedure, and what you were describing, he was describing getting goosebumps, and we were talking about physiological responses. And he said, sometimes, Mama, it's so hard to recognize these things. And I thought, yeah, often we do get really overwhelmed and it is hard to recognize them. So thinking about that, when you mentioned external support, I guess one concept that's mentioned quite often is co-regulation. So the idea that our nervous systems can settle when we're supported by another person. So is that what you're talking about when you're talking about getting external support to help regulate and bring you back down into that more regulated state? And how does that work?
So with co-regulation, we're using that support of another person who's in a calm and regulated state. And so calm's actually quite contagious. So if you've ever had the experience of being really worried or upset or anxious, when you've shared this with another person who meets you in a calm and relaxed state, then you may find that your emotions settle and you can think more clearly about your needs situation. And I think the same is if you think the reverse of that is anxiety. So I don't know whether you've ever had the experience of meeting somebody who's quite anxious. I think in a clinical situation this happens, and they're in a heightened state. So it's actually quite easy to become quite heightened ourselves. I think what happens is a patient might, say, for example, may present with heightened emotions, and clinicians can take on that anxiety and start going into action. So wanting to make multiple referrals, trying to problem solve, and become quite reactive instead of stopping, taking a breath and thinking about what's going on here, listening to the person before. Because what happens is when we're in that stress response system, we're in our survival brain. So the thinking brain shuts off. So a little bit like what you're saying with your son here, it was hard for him to think about what was happening because he's in survival brain. So thinking brain shuts off. So with co-regulation, if we're in that heightened state, we want to meet somebody who's calm because they're in their thinking brain. So when we're in thinking brain, then we can start to think about, okay, what's happening here? What do we need to do? Make sense of what's happening. But we can't do it if we're both in survival brain. So we need somebody who's in their calm thinking brain.
It's so interesting. As you're talking, I was thinking back to when I was a new genetic counsellor the first few years that I was working, and I can see how I caught the anxiety of my patients, and I can remember myself running around and trying to make prenatal testing happen as quickly as possible and getting people in for appointments as quickly as possible and being really reactive. And I guess as you build your expertise and you've become more familiar with these concepts, you are better able to sit in that calmer state. But yeah, that really resonated for me. So what sorts of things can practitioners do to help people come into that calmer state? And also, what can people do for themselves to help that?
So I think for clinicians, it's first of all being aware of your own arousal state, I guess, before you go into a meeting, depending on whatever your context is. What's actually happening for me? And you might be having a busy day. You might be, maybe you've had a stressful time at work. You need to down-regulate. And so that might be taking some deep breaths, coming into your body, being aware of how you're sitting, your posture, because how you present yourself is going to communicate to the person you're calm. So it's maintaining eye contact, open body language, listening, not only with your ears, but with your body as well. and validating the person's feelings. So that, and I guess that's what helps the person to downregulate. For themselves, I guess it might be helping the person to identify those strategies, and we want healthy strategies that they might normally engage in to support their well-being. Because I think what happens is when people are stressed or anxious, they may default to unhelpful strategies. So I think that's the first thing. What are the things that help you? So it might be, I think things, physical exercise are good, because we know that, say, for example, a brisk walk is going to deepen your breathing, decreases muscle tension. Staying connected to your social support. So I think connection helps us downregulate too, because we're sharing what is happening for us. I think being in nature, doing what we call pleasant activities, so going to the movies, going out for dinner. I think things like journaling can be helpful. Like if you're in particularly a situation where there's uncertainty or somebody's trying to manage in this sort of situation of prenatal diagnosis, I think writing down your experience, so getting it out of your head. And there's lots of thoughts and things might be swirling around your head when you're in that heightened state. So getting it out on paper can also help us make sense, I think, of what's going on for us. And I think breathing. Sometimes breathing, it always sounds like a simplistic thing, but actually breathing is quite powerful in actually connecting with that parasympathetic or rest and digest system. So things like box breathing, which is a particular technique, exercises like yoga, which combine breathing and muscle relaxation. So they're the types of things that can help. The other thing I think is a nice grounding technique is the 5 senses, like whether you've heard Ali, 5, 4, 3, 2, 1. So because by connecting into our senses, we get out of our thinking brain. So it's another way of getting us out of that ruminating thought. So you think about 5 things that you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, 1 thing you can taste. So I think sometimes there's some things that people might better do themselves to help in times of stress.
Yeah, and the breathing one particularly is so key because, as I understand it, it's one of the ways that you can tell your body physically that you're actually physically safe, because it's an evolutionary sort of response to see a threat as there's a saber-toothed tiger or some sort of physical threat, but you can't breathe calmly and slowly when you're running away from a saber-toothed tiger or jumping away from a snake or something. So the breathing is like when I started learning about this, it helped me to understand that it's a physiological signal that you can consciously give to your body to say, the space is actually safe right now.
Yes. And I think it gives your mind another focus as well, because you can focus on, particularly if it's something like box breathing, you're breathing in for 4, out for 4. So the counting, the focusing on it takes you away from whatever else, externally that might be contributing to your anxiety, for example. Yeah.
So thinking a bit more about connection, because as you were talking, I was thinking, we know that's really important, but in early pregnancy or any time in pregnancy really when results come up, but particularly early pregnancy, often people are reluctant to have shared the news about their pregnancy, and they're reluctant to have talked about it with others. And this time can naturally become quite an isolating time. Are there things that can help in that space when it feels isolating? Is it more helpful to focus on allaying the concerns about communicating and just communicating anyway? What are your thoughts on how to manage the isolation component?
It's interesting because I suppose it is a time of introspection, I think, to some extent, that early pregnancy. And that's, going back to your first question, there's so much happening that I think people sometimes can go a bit internal into focusing on all those thoughts and emotions that might be happening for the person. I think it's really a unique to the person and what is going to work for them. I think some women may need that period of just going inward to process what is happening for them. But certainly we know that by reaching out and connecting, that does buffer stress or difficult emotion. So it's a bit of a, it's a difficult one really, because we can't make people, but we could encourage people that there may be benefit in sharing their experience with somebody, or identifying somebody who might be able to hold the range of challenging emotions they might be feeling. So it might be things people don't want to share with those close to them. Because I think that sometimes in this sort of perinatal period, there are emotions and thoughts that people might be ashamed to share with others for fear of people's reactions. I think there's a lot of polarities that people might experience. I want the baby, but I don't want the baby. Or if I'm thinking more post-natal, I love my baby, but I hate my baby. They're not things that we can tell everybody. So it's identifying the people that can cope with that or hold that. And that may be a professional person. It might not be somebody in your circle, depending on the range and intensity of what you're feeling. Does that?
Yes, it makes perfect sense. So you may need to carefully look at your circle and look at whether people have the capacity and the skills to be able to hold what you need to share. I was thinking about that a bit more in terms of often pregnancy is described as a happy time. And so there's almost like a societal pressure to feel happy. Actually, if we go back to right at the beginning, all the different factors that you were describing and all the different impacts, a lot of those are not necessarily going to come with those happy emotions. So how do you find people navigate that inconsistency in societal perceptions, but how they might really be feeling? And I guess layered on top of that, unexpected news in pregnancy.
I think that's where you tend to see probably people coming into for more counselling or professional space, because I think often in the context of our work, a lot of those things women have never voiced. They keep that to themselves, or maybe too close, like their partner or perhaps their own parents or close friends. But generally, I think people tend to keep them to themselves. And I think that's where coming into a more maybe professional counselling space to voice some of that is important, because otherwise I don't think it gets processed. And then it may come out in people feeling depressed or anxious or withdrawing from work, from friends, not connecting in with the pregnancy, connecting with the baby. So I think it is, I don't think they're things that are easily shared.
So can you shed a bit more light on what that professional counselling space does look like? How do you and your clinical practice support people in navigating these complex and mixed emotions?
I guess as a mental health nurse, I see that in the context of that relationship, we listen and hear that story or your story and what brought you to the encounter today. And I think it's about being curious about those ideas and thoughts and emotions that women are having and listening to them, validating them and not judging. Because again, I don't think they're things that people voice openly. And I think we're often doing that co-regulation in this counselling space or as a mental health nurse. So that's listening, I think being calm and relaxed in the client's presence, giving space for those emotions, for those thoughts, not jumping in, trying to problem solve, validating those feelings. And again, not judging and not, sometimes women can say some things that can be alarming, but we need to be able to manage that and not take on that anxiety ourselves. And I think if there's complex decisions, it might be a space to just think about the understandings the woman has, her options, because sometimes there might be things women don't want to talk about with those closest to them. So it's a space where they could discuss that. We might do practical things like how you can manage stress, support women with those strategies that we talked about. And I guess for me, really, it's about that relationship with another who's going to walk alongside you for a period during a challenging time and help you navigate through it so you're not alone.
Yeah, it sounds like an amazing summary and so needed and so important. How do you find What do you observe as people go through that process over a series of appointments? What sort of changes or adaptations do you observe in them in terms of how that counselling is helping them in their situation?
I think often people always arrive in heightened
Mm,
distress. And I think just having that experience often of being heard immediately downregulates the person. And I think feeling that sense that they're not being judged, because I think there's a lot of pressure on women about being a certain way when you're pregnant and in motherhood. I think there's a lot of societal expectations. And I think that drives a lot of anxiety and distress. So I think it's almost like a relief I see sometimes in women, a relief that I can actually talk about these things, a relief that I'm not going crazy or I'm not the only one experiencing
mm,
these type of feelings. I think about intrusive thoughts when women are anxious. People can experience intrusive thoughts about all sorts of things that they can't, feeling like they can't control it. But even just knowing that that's a common experience in pregnancy and when women are anxious to have intrusive thought, even though they might see the thoughts, you might think, oh gosh, why am I having these
mm,
odd thoughts? But just even knowing that we see this all the time and actually you're not the
mm,
only one. Think so for me, it's that journey of people come in a really heightened aroused state. And then I think by having that regular space to voice, to have what's happening to them, to have somebody explore with them what's going on for them. And I think it's about being seen. I think that's another big thing. Somebody
mhm.
seeing you for who you are and what your experience is and accepting of that and holding that. I actually think it's very powerful.
And thinking about all those wonderful benefits, it all also make I'm sitting here thinking about the barriers that exist to stopping people from accessing that support when it can be so helpful. But I know sometimes there is a bit of concern or perhaps perceived stigma about
Mm.
accessing counselling. How do you find, what's your perspective of those barriers and how do people overcome them or rationalize them so that they can access that support?
It's a good question. I do think stigma is a big one and shame that they're not happy about being pregnant or stigma or fear that if I discuss some of these things or admit these things, someone's going to take my baby. I
Mm.
think that's another one that I see in the context that I work. I think, unfortunately, sometimes people have to get to a real crisis level, and that overrides sometimes, I
Mm.
think, some of that stigma or fear, and then come into a counselling kind of setting because things
Mm.
have actually reached a point where they're in overwhelm and I actually do need to reach out. I think sometimes women can hear from other women and that may, what's the word I'm thinking, break down that barrier because they
Mhm.
hear of another woman's experience. So through mothers groups or, yeah, I had a woman I saw recently and she had gone into a private, well, the baby unit, but she was telling all the women in her mother's group how wonderful it was. And so that kind of,
Mm.
to break it down, that this was actually a positive thing to do and shared her experience. And I think those kind of, that type of thing might break down barriers. If women share with one another, then I suppose now too, we have a lot more information online, services out there that, like Panda, Gidget, different places that, so this is more on the table. I think people are
Mm.
talking more about women's experiences and I think that breaks down barriers as well. If women have information, then they can make choices about where I can get help and it's okay to get help.
Yeah, absolutely. And I also think the pandemic did a lot for raising people's awareness about the potential mental health impacts. I was just thinking as you were talking, what can practitioners do to support people? Because I guess one of the things that really motivated me to start GenoCare was that in addition to my clinical practice as a genetic counselor, I was doing research alongside that. And I was consistently seeing in the qualitative research that we were doing evidence of really significant emotional impact. I think more than we recognize as genetic counselors. And also recognizing that genetic counselors are often seeing people right at that pointy end of the crisis, but not necessarily having the continuity of care further on as well. And so part of my motivation for setting up GenoCare was actually to try and look at how can we get creative about providing more access to psychosocial support. But a really common response that I get from practitioners is I'll offer this to patients who I think are having a really hard time. And what I had found in my clinical practice was I had just started offering psychosocial support to every single patient because my research had really shown me that sometimes people can look like they're fine at face value, but actually you do a qualitative interview with them and they start telling you really how they're feeling and they're not feeling fine. And so I had just adopted this approach of saying, look, getting a result in pregnancy, a genetic testing result in pregnancy that's complex is really tough stuff. We know that. And so you absolutely can access more psychosocial support if that would help you. I'm just interested to know what you think about how practitioners can navigate this so that people do get the support earlier in the picture before something reaches a crisis point, like you were mentioning before. Yeah, what are your thoughts there?
I guess psychosocial support should just be part of the whole package, isn't it? I think that because it can be focused on the physicality of pregnancy rather than thinking that emotional well-being, the social context, all that should be part of the care. So it's about making it part of the overall care because it should be woman-centered care, whole person care, and that is a component of that. And I guess it's how you introduce it as well. Because it's interesting. I'm just trying to think of the wording that you use. People say, "Oh, this might help you," or because inherently, then you're saying, "I think there's something wrong with you." So I wonder sometimes it's how it's how it's sold to the person. That if people are already feeling judged or stigmatized or right, you're telling me there's something wrong with me, then they may not want to uptake a service then. So I think we need to be mindful of how we explore with the person what actually they need. Because we need to be, I think, sitting with them and trying to explore. So then sometimes they can come up with the idea themselves. That makes sense. But rather than telling people.
Yeah. So it's woven into the conversation. So the approach is that consistently offering it, but weaving it in a way that people don't think that you're specifically offering it to them.
Correct.
Because you have a particular concern. It's just more, this is a stressful time for everyone and anyone can benefit from this kind of support. And it's something you could consider if you would like, sort of thing. Or as you say, weaving it in a way that they actually come up with the idea themselves.
Yeah. And have you talked to anybody about some of these things that you're feeling? What do you think it would be like to talk to somebody? Or have you had an experience of talking to somebody before about emotion and what's been happening for you? Like they come from a more exploratory frame, and then maybe sometimes I think then people generate their own idea as well. Yeah. But ultimately, I think it should be part of your care, part of the overall care.
Absolutely agree, as you can tell from what I was saying before. That's all the questions I had. Was there anything else that you wanted to share about this particular topic?
I don't think so. I think we've covered a lot of ground there.
Thank you so much, Kathy, for sharing all that experience and those wonderful perspectives from many years of practice. As I said, we're very lucky to have you on the team.
Thanks so.
And yeah, thank you again.
And I feel lucky to be on the team. I think this is I think it's it's like you've discovered a new niche that's been untapped. Yeah, I think this is important work. So thank you.